welcome back to You Pick Table today. We're grateful to have our guest, Ana, and we will introduce her shortly so you can know a little bit more about her. Um, but every April, the U.S. Department of Health and Human Services Office of Minority Health observes April for National Minority Health Month. And this is essentially a health month to highlight the importance of improving health, the health of racial and ethnic minorities and American Indian, Alaska Natives communities in reducing health disparities. Essentially, when patients are provided with culturally and linguistically appropriate information, they are empowered to create healthier outcomes for themselves and their communities. And so today we're going to discuss how to better advocate for yourself in your health appointments and when you're meeting with your healthcare teams. And so we're grateful to have Ana. A little bit about Ana is she's actually a recent graduate with an associate's degree in medical assisting um, from Unitech College, and she went into this after high school to help her mom so that she could gain the tools and skills needed in order to help her mom. After understanding the training, knowledge, and skills that it takes in order to be a medical assistant, she knew early on that she wanted to do this as a career. And so Anna says that being a medical assistant actually gives her the opportunity to work with patients with similar disabilities as some of the loved ones she has in her life, and not only to help those who are in need, but also to develop a useful skill. And so we're grateful to have her here on our call today. We have a series of questions that we're going to go through, which will kind of highlight for us how to better advocate for our health in our everyday life. So Anna, why would you say it's important to advocate for your health?
So I think it's important for self-advocating because it involves about speaking up about your feelings and asking for what you need, making sure your rights are respected. And I think this would give the healthcare provider to treat you more efficiently and effectively just by advocating for yourself.
I love that. Yeah, for sure. And how could we help? I guess how could we also help loved ones understand health literacy?
We could use friendly terminology, and we could also help the healthcare provider understand our communication and our concerns or questions.
I love that. Yeah, so I would probably echo that too because I'm sure many Pacific Islander children and loved ones kind of go in with, I mean, I know I did when my dad was sick. I always went in to his appointments with him. And my dad was very bright, but just sometimes the terminology was like way over both of our heads.
Right.
And so I like how you mentioned like having questions and like going in and voicing those concerns because I feel like sometimes, I'm sure not intentionally, but sometimes healthcare teams can just be like, okay, everything's looking fine. They're
Yeah,
looking for everything's
you
good.
guys are ready to
Yeah,
go.
yeah, any questions? And then you're like, what? We've only been here for 5 minutes.
Like a million questions.
Yes, exactly. And I love how you said just like going in, having questions and taking things like concerns that you have to your healthcare providers. I feel like that's important. Like before you go in to make sure that you're ready with questions that you're going to have for your healthcare team because they're not going to know if you have those questions unless you ask them. So I love that. For you, what are some of the tips that you have for when you go into your appointments? Is there any tips you can share with us that I feel like get you prepared for when you go in or even advocate for your mom? What are some things that you wish you had known earlier on?
Some things I wish that I knew earlier on. I would start with mm, oh, being important. Something important is being on time to the appointment. And before going in, write down your concerns and questions, request an interpreter if needed, keep your doctor informed and updated. If you feel necessary, bring a family or friend along.
Okay, those are all super good tips. And I like how you mentioned that you can bring someone along. So sometimes I feel like, especially for our older generation, it's scary to go into appointments where maybe you're not confident. And even like even for my mom, sometimes she's like very proficient in English. I feel like at the end of the appointment, she's like, okay, so what did they say?
Yeah.
You're like, girl, we were both in this appointment, but I like how you mentioned to bring somebody along with you. If you need somebody to come with you, I feel like that's so good to invite somebody because it really does. It allows us to have the support, and sometimes it's just emotional support. Like maybe you do understand what's going on, which is great. But I feel like even sometimes people may need just the support of having somebody who makes them a little bit more comfortable in the room with them, and that's
Yeah.
absolutely okay. And then I like how you highlighted again, like, writing the questions and concerns and bringing that to the table, because I'm going to tell you what, sometimes these doctors, they're just going appointment to appointment. And unless you give them concerns and questions, they're not going to slow down.
Yeah.
It's just the way of their work. So I love how you highlighted that. Um, for me, I wondered if you could tell how do you know you can trust a doctor's word? Like how can you find reputable doctors to go to?
Um, so how could you trust the doctor? Um, I feel like with you being more communicative and more understanding to them, they will be more communicative and understanding to you. So it will build like a bond or relationship between you and the healthcare provider. I think that would really should make a difference
Oh yeah, I agree. I would say so
of
for sure.
trust. Yeah,
I think for a long time when I was going in for my dad's appointments, even though my dad spoke English and was like sitting in the room, they'd ask him a question and he'd like look at me. And I just told him one day, like, hey, if you don't talk to the doctor, they're not going to know what a good person you are and connect with you. And he's like,
yeah.
I don't want to connect. I'm sure many Polynesian parents are like my
He's
own.
like,
So I just
I
want you
bring
to know
you
you're
for
not
you
alone
to
out there.
connect.
Yes, you're not alone if you have parents like that. They're going to look to you like, I don't know where your pain in your knee is,
Yeah,
so you're going to have to show them. But I feel like that's so important is like the communication. I feel like that's important because you're right. It will build a rapport with the doctors to better know like, oh, these guys, he knows what's going on, he's able to communicate, and it's going to make them want to reciprocate and also be communicating better. So I love that. That is so true. And I think just opening the lines of communication can help so that there's less misunderstandings when you're walking out the door. So I love that. um I wondered if you what types of questions, like, could you maybe use yourself as an example, or maybe people that you've worked with without disclosing too much because of HIPAA? But what types of questions might you bring to your doctors? Like, could you give me some examples of some of the questions that you might go into an appointment with?
so for me, some question I would immediately ask my doctor is like if I'm feeling ill or anything, I would immediately ask him like what's going on? How can I help this uh illness or
Yeah.
disease or yeah, like how can I treat this in any way or also like medication. I would
Mm.
ask a lot like questions about medication and what pills I would be taking. Um, I know I have a lot of questions. I do always have a lot of set of questions when I go into appointments, so I have
No,
to.
those are good. I like how you mentioned how you can be proactive on your end. I feel like
Yeah,
sometimes as Polynesians, we tend to be a little bit more reactive, you know? So I feel like it's so important to know like how can I what are things I can do on my end that are going to help me get better. And I like that you mentioned the medications because I feel like that's also something important to note is especially if you're going to like a new healthcare provider, like have a list of the medications that you're already on, so that
Yeah.
when they are diagnosing you with like another medication, is it gonna
Affect-
clash with another
Yeah.
medication, you know? Like, so I remember my mom would carry around for my dad's appointments like a bag of his pills that
Hmm.
we would have here at home, and anytime they're like, "What pills is he on?" and she's like lining up the bottles. But I feel like that's such a useful thing to know if you don't have it a bag, just like writing down what medications you're on regularly and knowing what dosage you take.
Hmm.
Because if you are sick or something else arises, it's nice to know and to let your healthcare providers know what it is so that they can diagnose you appropriately. And I like how you mentioned asking questions about what they're going to like what medications they're going to prescribe for you, because um, I think oftentimes when we're like, okay, when somebody gets a diagnosis and they get the prescribed medications, oftentimes they're like, is there any questions? You're like, no. But I would ask, I would say the same thing as you, like, how am I going to feel on this medication? What does this medication do? What will this help me with?
Yeah.
And how does that tie to your symptoms? Because I just think as Pacific people, we're so
Yeah.
respectful. And it's not a bad thing to be respectful, but I would also challenge us to be inquisitive, to ask the questions that are going to help for your loved ones and for yourselves, really what's going to help you to know your conditions moving forward, how to improve your health, like you said. I think that's so, so important because I feel like culturally there are some things that when we're in healthcare settings, you see people who are educated and that should be, they almost are like authoritative figures. And oftentimes in our culture, we give more respect and
Hmm.
obedience individuals, that sometimes it can seem a little disrespectful to ask the questions. But I really, really want to challenge our people to ask the questions because I really know for myself that the healthcare providers want to answer. They want to answer you. Like, you're not going to come in with your list of questions and they're going to be like, sorry, no time. I
Yeah.
feel like those cases are going to be very rare, but for the most part, they're gonna try and answer your concerns. So I love the idea of being prepared, questioning, what will this do? What are these symptoms? And, why am I sick? What's going on? So it's okay to ask the questions because a lot of it is just testing to see what it is, to see, so they're doing tests too, they're trying to figure out with you. It doesn't hurt to ask the questions so that you can feel like you're getting, the best help possible.
Yeah.
So I love that. Like for us on this end, what can we do to better increase our own health literacy?
Um, like speaking up about your feelings, uh, asking for what you really need, um, while still making sure you're being respectful and making sure your rights are also respected.
I love that. I love that. So it really is. I think that you've highlighted it well on this call, and I'm so appreciative of it. Is really at the bottom of it, at the when we uncover a lot of things, a lot of it is just communicating. And I feel like that I think everyone can improve on communicating, but especially when we're trying to develop our healthcare literacy, I think that it's so important to ask the questions to, and I think do the research. If you get a diagnosis in a healthcare appointment and you're depending on the papers that the doctor gives you to tell you everything about this condition, it's just not going to happen. you
Yeah.
not going to tell you everything. So I feel like even knowing certain diagnoses, I feel like it's important to also do your research from credible resources as well. I have a personal experience too when my dad was diagnosed with a very rare blood condition. I remember they gave us a packet of information and like the medications he would be on. And I remember my siblings and I researching every single medication, the side effects. I remember we were Googling and trying to find anything about this condition. about how to improve it. Like you were saying, like to try and be a little bit more proactive, because at the end of the day, it's so important that although we're going to increase our health literacy, it's important to know that, no one's going to care more than us and our loved ones about the condition of our health. A healthcare provider is going to be caring about how to give you the diagnosis and how to help you, but they're not going to be equally as invested as us and our loved ones. And I think that's so important to understand is really at the end of the day, we need to make choices that are going to help us communicate better with our healthcare teams, communicate better with our loved ones, and to stay advocating for our health and the health of our loved ones. So, Anna, thank you so much for joining us on You Pick Table today. We really, really appreciate it. Is there any last minute things that you want to say as we close out our call today?
No, thank you guys for having me.
Thank you, Anna. Just as we close out today's call, I wanted to go over our data here for the Utah Pacific Islanders here in the state of Utah. Currently, there is 19,962 Pacific Islanders to date who have contracted COVID-19. This is actually the highest infection rate of all races and ethnicities here in the state of Utah, about 59,377 cases per 100,000. There have been 12 Pacific Islanders that have been infected with COVID over the last week, and the Pacific Islander case rate is about 1.76% times higher than the overall state rate. There is approximately 1,475 Pacific Islanders who have been hospitalized for COVID-19. This is also the highest hospitalization rate of all races and ethnicities, with about 74 hospitalizations per every 1,000 PI cases. Two Pacific Islanders have been hospitalized with COVID-19 over the last week, and the Pacific Islander hospitalization rate is about 1.9% higher than, or excuse me, 1.9 times higher than the overall state rate. To date, 133 Pacific Islanders have died of COVID-19 in Utah, which is the second highest mortality rate of all races and ethnicities. This is about 396 deaths per every 100,000 in PI population. And there is one Pacific Islander who has died from COVID-19 over the last week. And the Pacific Islander death rate is about 2.4 times higher than the overall statewide rate. And so I hope that these statistics are eye-opening for all of you as much as it is for myself. Thank you for joining us on You Pick Table today, and we will see you again next month. Lava, yeah, Manuel Thank you, Anna.